Good morning. This is Assunta Podcast Episode 8. Talk with Dr. Ganasan about tuberculosis. I'm your host, Aaron. As you well know, we have an outbreak in Malaysia regarding the tuberculosis. So today, we have here with us Dr. Ganasan. So, Doctor, can you please introduce us?
Hi. Morning, Aaron. Thank you for
Morning.
hosting today's Assunta podcast episode number 8. Yeah, right. So, I'm Dr. Ganasan. I'm your emergency physician in Assunta Hospital. So today we're going to talk about tuberculosis. I'm sure, Aaron, you are aware also that there is a sudden surge in TB cases in Malaysia, right? So let's talk a little bit about what is tuberculosis and what are the things that we should be expecting, okay, for the public to be aware of. Yeah.
Yes, Doctor. Sure.
Okay.
Okay. So, what is TB? Can you tell us what is TB?
Okay. So generally, TB means tuberculosis. Tuberculosis is actually a bacterial infection, right? Mainly because of a bacteria by the name of Mycobacterium tuberculosis, right? Now, the history of it is that it has been properly recognized in 1882, right? By a person called Robert Koch, right? He managed to isolate and then came up with this bacteria, and ever since then, we have been diagnosing TB for decades now, right? So it's a known infection to us, right? It has been with us for many, many years, right? With medical advancement, the management has become much better nowadays. We can treat TB nowadays. So that is actually tuberculosis. And currently, what people think is that tuberculosis mainly is only infection to the lung, but unfortunately, it's not. It can also impact other organs in our body. Yeah. So that is just a general overview, the history of tuberculosis.
Okay, all right. So actually, Doctor, what is currently happening in Malaysia right now?
Okay, so as many of you all are aware, right, there is a outbreak of TB infection that is happening in many of the states in Malaysia, which is actually quite worrying. Okay, if you look at the statistics that been released by the MOH recently, right, Selangor tops as the number one state with a lot of clusters. If I'm not mistaken, there is about 50 over clusters, if I'm not mistaken, okay, if I recall. In terms of cases, Selangor has actually recorded about 596 cases. That's number two in Malaysia. Number one is Sabah with 755 cases. So there is a sudden surge in the infection of TB, which we never seen previously. We had TB infection happening almost all the years, right? But there is a sudden surge in the infection that is happening in Malaysia. So this is quite worrying, okay? And I think it's time for us to, recall back or re-educate the community and the public on how important is it for us to identify TBs and start the management early. So for your question, we are currently facing an outbreak. It is definitely not as bad as COVID, I would say, right now. It's something that we should be worried about.
We don't want it to go that high.
Hopefully.
Yeah. So what are the signs and the symptoms of TB? The normal one that you see.
Okay, right. So tuberculosis or PTB, like we call that pulmonary tuberculosis. Like I said, pulmonary means most of the TB cases infects the lung, but there is in certain cases that it affects the other organs. We can talk about it later. Yeah. So I will refer to pulmonary tuberculosis, or we call it as PTB. So what are the common signs and symptoms that we actually look out for in a patient who comes to us with this PTB? Number one red flag would be cough, persistent cough, or cough for more than 2 weeks, right? Now this cough can be 2 weeks, can be not necessarily be a TB lah. It could be bronchitis, it could be just a chronic cough per se. But more than 2 weeks, the first thing that comes to any clinician probably that works in Malaysia is we need to rule out pulmonary tuberculosis. Okay, so the red flag number one is actually cough. All right. Number two will be fever. All right. So what is said in PTB is that the fever normally occurs at night, right? Most of the time, but sometimes it can also occurs in the daytime as well, associated with night sweats, right? So you have fever mainly in the evenings or in the night, and then associated with sweats.
Daily?
Yeah, almost daily. Yes.
So in the morning, you don't get any fever.
Like I said, it is not the mandatory thing, right? It can happen, but typically it's at night.
Okay.
All right. Associated also with loss of appetite, loss of weight, right? Sudden loss of appetite and weight, you can see on that, and also lethargy. Okay, so because you don't have appetite to eat, you lose weight, and then you tend to become lethargic. So these are the common things that you actually can suspect or you can see in a pulmonary TB infection. I also would like to add on regarding the cough. Sometimes when you have prolonged cough or cough more than 2 weeks, you tend to see some amount of blood in your phlegm of sputum. All right, so that is also something that we want to make sure that we screen for TB. Right, so cough more than 2 weeks consistently may or may not have blood in your phlegm associated with fever, typically probably in the evening with night sweats, and all the other constitutional symptoms like loss of weight, loss of appetite, lethargy, right? So these are the things that normally we want to look out for when a patient comes to us, especially in the emergency department or in any primary care setting. We would like to screen these kind of patients whether they are dealing with TB or not.
Okay. So, what about the other one? You said there's two, right? There's two type of TB, right? One is in the lung, one is in affects the organs.
Extrapulmonary.
But is it the same symptoms? So
No, all right. No, a part of pulmonary TB is extrapulmonary TB, we call it. Okay, it can infect your brain, it can infect your bone, your lymph nodes, right? This TB is generally difficult or it's quite challenging to diagnose. You know, they don't have any particular symptoms like how pulmonary TB establish or exhibit their symptoms, you see. So this kind of TBs, most of the time, it comes with the high index of suspicions. The means the patient is admitted most likely because we want to find out what is the cause of the fever or what is the cause of symptoms. Then we will try to screen that slowly and then we will find out. So what I'm trying to say here is that extrapulmonary TB, all right, or TB which is not in the lung, all right, it is more difficult or very challenging for us to diagnose instantly or easily, all right, compared to pulmonary TB. Yeah. So that are the two types of TB lah. One is the pulmonary, but one is the extrapulmonary TB. But what we are facing now in Malaysia currently is pulmonary TB. It's mainly on the lung infection. And interesting fact is this: out of these 500 over cases that has been diagnosed in this current surge, 85% of the patients are actually Malaysians.
okay.
All right. Okay. So there's a myth or there's a misconception saying that TB only occurs to socioeconomically very poor people or condition, but actually it's not really true. It's a myth. It can happen to anybody, right? So that's an interesting fact that I would like to share.
Nice.
Yeah.
Okay, doctor, can you tell us how can TB spread?
Oh, okay. Very important question, actually. So I think this is what everybody should be aware of. Yeah, right. So general principle. Okay. TB is spread through droplets, right? So what do I mean by droplets? So when you are facing someone who's actively infected by TB, so when they cough, when they sneeze, all right, these are the mode of transmission to you. So apart from that, having conversation in a very close room, okay, or meeting repeatedly with a person who's been infected with pulmonary TB, all right, also increases the risk of infection. So the point is here that it's spread through droplets, all right. So that's how mainly it's transmitted to another healthy person.
Okay, Dr. Ganasan.
Yeah.
So if I were to randomly shake hand with someone, will I be getting TB?
No, actually no. It's a myth actually. Shaking hand doesn't really transmit the disease to you, right? So like I said, it's droplet, mainly through coughing, sneezing, or very close contact for a repeated exposure a very long time. Yes, you are at risk of getting infected from the other person, right? So shaking hand, no, that's not.
Should be fine.
Yeah.
Okay.
Right.
All right. So moving on. So doctor, can you tell us who is actually at risk of getting TB?
No, generally everybody is.
Okay.
As long as you are exposed to a person who's infected, right, you are at risk of getting a TB, right? But who are at the higher risk of getting TB is those people who are immunodeficient or where the immune status, right, is actually at the lower compared to a healthy person. So these are patients who has autoimmune diseases, right, like lupus, HIV, or any other systemic diseases, right? So they have the higher risk of getting the infection more faster or more easier compared to a healthy person. But technically, everybody is at risk, but they are at the higher risk. Okay. Okay, this includes also elderly patients. Okay, because as we know, as we age, our immune system also depletes, right? On top of that, elderly patients who has diabetes, they are also at the higher risk of getting infection from this TB. Okay. Basically, other than that is children's, and they also say that smokers also at the higher risk of getting TB. Yes. So those who are in these categories, all right. So you have to be a bit more cautious. All right. You need to take some preventive steps, which we'll discuss later, I suppose. Right. To make sure that you are not at risk of getting TB this point of time. Right?
Okay.
Yeah.
All right. So what are the difference between active TB and latent TB?
Okay. All right. Interesting question. Okay. Maybe a bit technical, right? But I'll try to explain to you in a very layman term. Now, active TB is a person who's infected with TB and he has symptoms. Like all the symptoms that I have actually mentioned to you earlier, right? They have all the symptoms, right? Cough, fever, all right, lethargy, loss of weight, weakness, right? Latent TB is something like the TB is present in your body, but it is sleeping.
Okay.
So you won't have any symptoms, right? So that is latent TB. So the next question I'm sure you're going to ask, so is the latent TB going to become an active TB? Yes, they can. They can trigger to become an active infection later on in your life. Like how I said, those who are at the higher risk of getting infection of TB earlier, like elderly patient, patient with diabetes, patient with immunocompromised diseases. Yes, at the later stage, when their immune system is lower or not at the peak, all right, that latent infection may become an infection, right?
Is there a certain years like
No,
maybe?
we don't have a limit or timing to say when it's going to come. We can't predict.
So once it's in the body, then the latent one will still stay in the body.
They will be in your body, yes. But whether it becomes an active infection later on or not is a question.
Okay, all right, okay. Okay, doctor. So do how do we diagnose TB?
All right. So so if any one of them has any of the symptoms that I mentioned earlier, all right, I think it's wise for them to go to any doctor, all right, to get them screened. So now when you walk into any clinics, GPs or any emergency departments or any outpatient departments, the first thing is they're gonna examine you and they're gonna ask you some history. When your history is very suspicious, first thing we will do is that we will try to do like chest X-ray, all right? So we can see any changes in chest X-ray. Number one. Number two, we will do some basic blood tests to see whether there's any infection markers are raised. Okay. We will also do sputum test where we will ask you to give us your sputum 3 times, 3 different days, and we'll send it for testing. And a simple one that we normally do in the primary care settings or emergency department is what we call as mantuk test. Mantuk test is, even though it's not 100%, but it gives you an idea on whether we need to carry out further investigation on this patient or not. Basically, we inject some sort of tuberculin under your skin, and then we wait for it to see whether there's any reaction or not.
Oh,
Okay. So these are the basic things that normally we will do in any primary care settings. Okay. But there are some advanced investigation tools that we use also, such as we can do CT, right? Or we can even do bronchoscopy in cases which is challenging for us to diagnose. So we want to do a bronchoscopy and see and take the sample to send and see whether we can get any results or not. So these are more advanced, which is done by mainly by respiratory physicians, right? But basic screening tool will be, of course, your blood. The first is your symptoms, your blood test, your X-ray, your sputum, and then your mantle test.
okay.
Right? Yeah.
Right.
So basically, that's what we normally do.
Thank you, doctor.
All right.
So, how can we treat for TB?
Okay. I think the question probably many of them will be asking is that is TB treatable or not? Right?
Yes.
So it's 100% treatable. Right? You can treat TB. We have multiple drugs that we can use to treat. Generally, management of TB is a long-term management. It's not like how you go for your sore throat fever. You get your antibiotics for 3, 4, 5 days, and then some other medication, and after 2, 3 days you feel better and you're done off. It doesn't work like that in TB, unfortunately. Okay, the management is a bit more longer. So to be more specific, it can vary up to 6 months, right? Where you have to take medication almost every day. Okay, it's a combination of few antibiotics given together. Okay, they are divided into 2 phases. The first phase is called as intensive phase, where the medications are a bit more, all right, and then after a few weeks, then it become as a maintenance phase, where the medication they will cut down a bit and then they will continue giving you for the next 6 months. All right, sounds scary. All right, sounds scary, but it is effective. Right, it's effective. Of course, when you take the medication, we will have follow-ups for us to come and see you. We take some blood tests and see how you're doing with the medication, whether the medication is working for you or not. All right, so all that is important for us to check. So there'll be a bit more follow-ups in the journey of you treating your TB when you are confirmed to have TB. Right. So another thing probably I would like to mention to everybody is that when you are prescribed anti-TBs, we call this group of medications or antibiotics that we're going to give the patients anti-TB. Right? So when you are diagnosed with TB and you are prescribed with anti-TB, it is very important. It's very, very important for you to make sure you complete the course of the medication for the span of the time that the physician is giving you. All right? Never default your anti-TB medication. Okay? Reason number 1 is that when you default, of course, the process of curing your TB is going to be much difficult. All right? You won't basically cure your TB. Number 2 is that you're exposing yourself to have antibiotic resistant or drug resistant TB. So what is drug resistant TB? Drug resistant TB is basically the antibiotics that we are prescribing to you in order to treat you for PTB. It is not effective on you because the bacteria is not basically it's resistant, right? So when you have resistant TB, all right, to treat the resistant TB is much more challenging, all right? So the chances of you having complications, all right, from TB because of this resistance is much higher. Okay, so what you must understand here is that TB, you can treat it, you can treat the TB, but it comes with your commitment to make sure that you continuously take the medication for the course of time. So basically, I think that's how you treat a TB, all right? So there's incentive phase and also there's maintenance phase, a total of 6 months course, right? It's completely treatable, right? So, yeah.
So just to get this right, doctor.
Yeah.
So first I'm diagnosed with TB.
Yes.
Then I get my anti-TB. I finish the course of the prescription that's prescribed to me.
Mm-hmm.
And then I go back to and check if I'm cleared of TB. Is that right?
Correct. In summary, all right, if someone is diagnosed, that's the journey of the thing.
Okay.
But of course, I'm not going to discuss in detail how is the TB medication is delivered to you, how is it done in the hospitals. There's a bit more technical things inside that. But yeah.
I mean, that's the idea.
Yeah, that's the idea.
Okay.
Yes, correct.
All right. So
Yeah.
last one, doctor. How can we as Malaysians prevent this from happening to us? How do we prevent ourselves from getting TB? Is that possible?
I mean,
But now with the
outbreak,
the
yeah.
outbreak, the bazaars, everything,
Yeah.
even the daily when we
Correct. Yeah. So I think it comes back to the principle of how we managed ourselves during COVID. I think number one is the awareness, right, and also the discipline. So meaning, if you are going to go to bazaar, I'm not going to say don't go to bazaar, right? Please
go.
and
I love to go to bazaar.
Yeah,
anyways.
please you can go, but if you are going to go to a place where there's going to be a lot of crowd, where you're going to have to face a lot of people around, it's mask up. Yeah. For those who have the symptoms that I told, go and check it out, right, and see whether you are at risk or not at risk. Okay, if you are, then you take the necessary precautions, right? Because diagnosing a TB at the very early stage is very important because the effectiveness of the treatment is much better when you diagnose early and you start the management early. When you come at the later stage with the complication of TB, right? Chances of you curing the TB or the TB causing mortality is very high. Those who are staying in a house where a person is diagnosed to have TB, you need to get yourself screened. Okay, so that's called what we call as close contact tracing and screening. You need to go and screen. Okay, so basically, try not to have a very close contact with the person who's suspected or in any general crowd where you are sitting there. Just make sure that you have a proper distance and
1 meter distance will do.
I mean,
COVID is
no,
1 meter distance.
yeah. I mean, there is no hard and fast rule in that per se, but just have a safe distance, I guess. All right.
We have to quarantine as well ourselves and see.
If you are diagnosed.
Yes, if I'm diagnosed.
If you are diagnosed, yeah, most of the time there's not to say it's quarantine. It's basically we try not to have close contact with somebody, so you need to stay in a separate area. But you can see them, you can talk to them. It's not like how you did it in COVID. You isolate yourself. You can't be isolating yourself 6 months in the room per se.
Okay,
and
right.
you are allowed to go out. Okay, but you have to wear your mask. You have to make sure that you are far away from someone. Okay, so these are the things that we would like to educate the public. All right, so that you are aware that this is around, and try to take unnecessary steps so that you don't you know put yourself at risk. Okay, as simple as that. If you want to cough, you can close your mouth and cough. All right, don't cough, don't sneeze publicly. Like
Simple
and
ethic of how to cough and
Yeah.
sneeze, close your mouth,
Yeah.
and wash your hands.
you wash your hands.
Yes.
Your self hygiene is. Your hygiene is important. All right, and especially those who are at the higher risk. Like I told you, the elderly and the immunocompromised patients. So basically, these are the steps that you can take. We can't do anything other than that, but stay safe and be aware of what is happening around.
So you heard it. Stay safe, Malaysia.
Yeah, stay safe. Right. Okay, I think that's about it.
That's about it.
Yeah, on prevention.
Thank you so much, Dr. Ganasan.
Thank you. I hope
so much.
we have given a very brief idea on
Yes, you
what's
did.
happening.
You did.
Right, on TB, and hope it finds you well, and it helps you. Okay, to be more aware of what is happening around. Yeah. All right. Thank you, Aaron.
Thank you, Dr. Ganasan. So stay tuned for our next podcast. This is Aaron signing out.